Okay, let's unpack this. Welcome to the deep dive. This is where we take the sources you send us, articles, notes, whatever you've got, and we really dig in.
Yep, we sift through it all to pull out the most important insights, the surprising facts. Basically, help you get a handle on it.
We want to find those nuggets of knowledge for you, minus all the noise.
Exactly. We're your guides trying to make sense of the material you shared, figure out what really matters.
And maybe find a few things that make you go, huh, didn't know that.
Hopefully.
So today's deep dive, it's taking us into, well, the pretty complex world of medical tourism.
That's right. We're working from a transcript you sent over from a YouTube discussion. It featured a host and an expert RN, a registered nurse, who really specializes in this area.
Our mission today is to walk through that source material, break it down.
Mhm.
Why do people get medical procedures overseas? Where are they actually going?
What kinds of procedures, and maybe most importantly, how do you do it safely? How do you avoid the pitfalls the source definitely highlights?
Yeah, the transcript makes it clear right away. There are significant risks, some really intense stories, things you absolutely need to know.
But it also points out that for many people, maybe especially those from communities that haven't always had the best experiences with, traditional healthcare,
Right.
going abroad isn't just about saving money. It could be about feeling empowered, maybe finding better outcomes, or just having a different kind of healthcare experience.
So it's this mix, isn't it? Potential savings, potential access, but alongside real dangers that need careful thought.
Absolutely. A really informed approach is key.
Okay, so let's dive into that first big question the source tackles. Why? Why are people even thinking about going overseas for healthcare?
Well, overwhelmingly, the number one driver mentioned in the transcript, it's cost. Plain and simple.
U.S. healthcare costs are just
Yeah.
astronomical. And that's a huge motivator. The expert gave a really clear example with a tummy tuck procedure.
I remember that.
The surgeon's fee might be quoted at, say, $6,000 in the U.S. Sounds okay, maybe. Manageable, perhaps.
But then you add anesthesia, the OR fees, meds, the facility costs, and suddenly that $6,000, it jumps way, way up, maybe over $20,000 total.
Wow. And the comparison they made to going abroad.
Yeah, that was striking. Getting something complex like cardiac surgery done in a place like India,
Yeah.
the total cost, everything included, could be 50 to 70% less than the U.S. price.
50 to 70%. That kind of saving is, well, it explains the appeal, doesn't it?
It certainly does.
Okay.
And the source also mentioned, interestingly, supply and demand within the U.S. playing a role.
How so?
Well, places like Miami or Beverly Hills, where cosmetic surgery is super common, they might actually have more competitive pricing than other parts of the U.S. just because of the sheer volume.
Okay. So cost is huge. Are there other reasons people travel, according to the source?
Definitely. Faster access came up.
Yeah.
Avoiding long wait times for certain procedures back home.
Sure.
Also, seeking out very specific expertise. Maybe a particular surgeon or facility abroad is renowned for something specific.
Or different treatment approaches.
Exactly. Things like holistic cancer care were mentioned, which might not be as mainstream or easy to find in the U.S.
And the expert in that transcript, the RN, she shared a bit about her own motivation for focusing on this, right? Especially for Black women.
Yes. She framed it as providing information, providing tools, so people can make informed choices about their health. It's about empowerment, potentially leading to better experiences or outcomes, especially if they've felt underserved and neglected by the system here.
So it adds that layer. It's not purely transactional for everyone. It can be about seeking agency, control.
Precisely.
Okay, so motivations are clear, big cost savings, access, specific care, maybe a better overall experience. What kinds of procedures are most common? The transcript listed the top 3.
Yeah, the expert pointed to cosmetic surgery, dentistry, and maybe, surprisingly for some, cardiac procedures. Those are the big 3.
Cardiac always feels so urgent. How does travel work for that? Seems counterintuitive.
That's a really key distinction the source made. It's not for emergencies, not for like a sudden heart attack where you need help now.
Okay.
The cardiac procedures people travel for are typically scheduled. Things like dealing with arterial blockages caused by lifestyle issues. If these are caught early and planned for, there's time to research and make arrangements.
I see. So it's more like planned maintenance, not an emergency rescue mission. Got it. Besides those top 3, what else did the source say people travel for?
Cancer treatments were mentioned, though they noted the complexity and how approaches can vary a lot globally, especially with holistic options.
Right.
Fertility treatments, another big one, mainly because they're so expensive in the U.S. And interestingly, maternal health,
Mhm.
people actually traveling to give birth in another country.
Wow, that's quite a range
Yeah.
from elective cosmetic stuff to life-altering procedures, even starting life. So where are people going? The source named quite a few places.
Yeah, they gave several examples, often tied to specific procedures. For cardiac, they mentioned Thailand, India, Cuba, Turkey, Dubai, Spain.
Quite a list.
For cosmetic surgery, Turkey, Colombia, Mexico, the Czech Republic were mentioned. And the Dominican Republic came up too, but the expert specifically flagged some safety concerns there recently.
Okay, that's important context. And I recall Turkey and Budapest were highlighted for dental work and hair transplants.
Exactly. Turkey seems big for those. They also mentioned Korea as being known for high-quality care in Asia, though not tied to one specific procedure in that list.
So it sounds like some countries are general hubs, maybe, while others are known for specific specialties.
That seems to be the picture the source painted. And they also touched on the growing scene in Africa, Egypt, Morocco, South Africa, Kenya, even parts of Nigeria were mentioned for various things like birth, cardiac, GI procedures.
Okay, this all sounds potentially great from a cost perspective, maybe access to, but the transcript really didn't downplay the risks. So let's get to the absolute crucial part. How do you actually vet these options? How do you ensure safety? What was the number one first step?
This is where the source really hammered home a key point. The most critical first step, according to the expert, research the facility first, not the doctor, the facility.
A facility first. Why start there?
Because the facility standards, its accreditation, that tells you so much about the whole environment. Safety protocols, technology, how they credential the doctors who work there, it's foundational.
Okay.
And the transcript specifically highlights accreditation. It introduces the Joint Commission International, or JCI.
GCI, yeah, I think I've heard of that. What exactly is it?
So JCI is basically the international branch of the Joint Commission, which is a major U.S. nonprofit that accredits American hospitals and healthcare systems.
Right.
JCI does the same thing, but globally. They accredit healthcare organizations based on really rigorous standards for quality and patient safety.
So if a facility has JCI accreditation, that's a really strong positive signal.
Absolutely. The source explained that facilities seek this out voluntarily. It's a demanding process. Annual reviews, on-site surveyors, checking everything. It means they're committed to high, internationally recognized standards.
And that helps vet the doctors too.
Yes, because part of that JCI process involves checking the credentials of the surgeons and physicians practicing there. It adds a layer of verification.
How would someone actually use this? Find out if a place is accredited.
You can go right to the Joint Commission website. They have a search function. You can look for accredited places by country, by the type of service you need.
Okay.
And the source strongly advises checking the current status. Accreditation isn't permanent. It needs to be maintained. Good facilities usually advertise their JCI status prominently on their own websites, too.
So JCI is kind of the cornerstone for checking the facility. What other resources did the transcript mention for doing your homework?
Patients Beyond Borders was another one. It's reputable, offers data, info on countries and procedures, often more from the patient's viewpoint. And then for getting a feel for the location itself, you know, the city or town where you'll be staying, things like TripAdvisor, or finding expat or repat groups online for that specific city.
Get some local intel.
Exactly. Boots on the ground insights about general safety, what the area is like. Invaluable.
Right. So once you've maybe found a promising, accredited facility, what are the absolute must-ask questions for the facility or the doctor based on the source?
Okay, several critical ones. Obviously, ask about the clinician's credentials, their specific experience with the procedure you need.
Standard stuff.
Yes, but the expert added a key detail. Ask for before and after photos, specifically of patients who are similar to you.
Similar, huh?
Similar body type, similar skin type. And mention any specific concerns you have, like they use the example of keloid scarring, which can be a bigger concern for Black patients. Ask if they have examples addressing that specific issue.
That's really specific and helpful. It goes way beyond just seeing generally good results. What else is non-negotiable to ask?
This might be one of the most important points from the source. Get the surgeon's name written into the contract.
Written in. Why?
To make absolutely sure the surgeon you researched, the one you consulted with, the one you trust, is actually the person doing the surgery. The source emphasized this, prevents you from being handed off to someone else unexpectedly.
Wow. That feels like, yeah, a crucial detail, knowing exactly who is operating. What about the procedure itself?
Ask about the specific techniques they'll use. Ask about the materials the source mentioned, for example. Concerns sometimes arise about the quality of dental materials used internationally, so verify that.
Okay. Materials, techniques. What else?
Protocols. What happens if there's a complication? Or something unexpected comes up during or after? What's their plan? Who handles referrals if needed?
And cost, of course. The breakdown.
Yes, get it all itemized. Anesthesia, facility fees, meds, surgeon's fee, everything. But here's the critical follow-up question the source stressed. What about costs for unexpected complications?
Ugh.
What if you need a longer hospital stay? More tests? Another doctor gets involved. How does that affect your travel costs, your accommodation costs? That's a huge potential hidden expense.
That could absolutely wreck your budget if you're not prepared. Turn savings into debt fast. Anything else on the list?
Ask about their recommended recovery protocols. And importantly, how long do they recommend you stay in the country after the procedure before you should even think about flying home?
Good point. The transcript also mentioned using facilitators or concierges. What's their role?
Yeah, medical tourism facilitators. They can basically handle a lot of the logistics. Travel, accommodation. Sometimes they help with the vetting because many work with accredited facilities already.
Are they recommended?
The expert in the source seemed to lean towards individual facilitators, feeling they might be more client-focused than big companies. They suggested asking how the facilitator gets paid. Is it a percentage? Does the facility pay them?
Does that matter?
The expert felt that as long as they're steering you towards properly accredited places, the payment method isn't necessarily a deal breaker itself. They also mentioned health concierges as an option for support while you're actually in the country recovering.
And language barriers, is that usually an issue?
The transcript suggested that many facilities targeting international patients have English-speaking staff or translators available.
Okay.
Learning a few key medical terms in the local language is still probably a good idea. India was specifically mentioned as a place with many English-speaking clinicians.
Okay, so you've done the research, picked a place, asked the questions, got there, had the procedure, now recovery. The source had strong opinions on where procedures should even happen.
Absolutely. This was another non-negotiable point from the expert.
Yeah.
Any procedure that involves anesthesia or being, cut open, basically, significant surgery,
Yeah.
should be done in a hospital setting, not just a clinic.
A hospital specifically. Why so adamant about that?
Safety net. Hospitals have the infrastructure, proper operating rooms, ICUs, specialists on call, trained emergency teams to handle serious unexpected complications. Things like a sudden respiratory issue or a cardiac event during or right after surgery.
Things a small clinic just isn't equipped for.
Exactly. The expert was clear. If a major surgery is only offered in a clinic, that's a huge red flag. You should probably look elsewhere.
So trying to save money by opting for a clinic for something major is really gambling with safety. What about the recovery time before flying home?
Generally, the minimum recommended is about 7 to 10 days before getting on a plane. That's mainly due to risks like blood clots and issues with air pressure changes post-surgery.
But for bigger stuff.
Yeah. For major procedures, the source mentioned neurosurgery, cardiac, extensive cosmetic work. The expert strongly advised staying in the country for a month, maybe even longer.
A month or more. Why so long?
It allows for real initial healing. It lets you have those crucial post-op follow-up appointments with the surgeon who actually did the work. And honestly, just gives you time to genuinely rest and recover before dealing with the stress of travel.
What are the actual dangers of flying back too soon or just rushing home?
The main risks highlighted were blood clots, which can be fatal. Dehiscence, that's where your incision or suture split open. And infections. All serious complications you want to avoid, especially mid-air or right after getting home.
And the transcript brought up a tricky point here. What happens if you do get a complication after you're already back home?
Yeah, that's a real challenge. Finding a U.S. doctor who is willing or even able to properly manage a complication from a surgery done overseas can be difficult. They might be hesitant due to liability or just unfamiliarity.
So that really underscores needing enough recovery time in the country where the surgery happened.
Exactly. And having some kind of plan, however difficult, for potential post-op care back home.
The source also talked about just resting, even once you're home.
Yes. People feel pressure, right? Get back to work, take care of the kids, run errands, but your body's still healing, potentially from something major. Avoid heavy lifting, limit strenuous activity, give yourself that time, even in your own environment.
They circled back to vetting the location itself, not just the hospital.
Right. Using things like TripAdvisor or expat groups isn't just for the initial decision. It's also about knowing the city or town where you'll be recovering is safe, comfortable. You need to feel secure outside the hospital too.
This deep dive has really covered a lot from that source material. Let's maybe zoom out for a second, like the transcript did, look at the bigger picture. It brings us back to that cost versus quality thing.
Yeah, it reinforces the idea that while cost savings are often the main draw, just grabbing the absolute cheapest option, that should probably be a red flag. Quality, safety, those have to come first.
And the transcript did kind of put the U.S. system in context.
It did. It acknowledged the realities here, the huge costs, yes, but also other issues like the high maternal mortality rates, especially for Black women. These domestic problems are part of why people feel pushed to look elsewhere. It's not always just a casual choice.
They also touched briefly on how medical tourism gets portrayed in the media sometimes.
Yeah, the observation was that U.S. media often focuses heavily on the horror stories, the tragedies, the bad outcomes,
Right.
often without giving the full picture.
Right.
Without acknowledging that bad outcomes happen in the U.S. system too, or that many, many medical tourism trips are actually successful and safe when people do their homework.
So it encourages looking at data using the resources we discussed, not just reacting to headlines.
Exactly. And one final point on vetting regarding alternative medicine abroad, the source just noted that's much harder to vet internationally because you don't usually have those established accrediting bodies like JCI for those types of treatments.
And one last piece of advice from the transcript.
Yeah.
Talk to your doctors here, if you have them.
Yes. The expert suggested having an open conversation with your primary care doc or specialist here in the U.S. before you go. Even if they're not thrilled about the idea, they might offer really valuable advice on questions you specifically should ask, information to get, risks related to your health. They can help you prepare more safely.
Okay, this deep dive into the source you provided on medical tourism has been, well, really illuminating. We've gone through the reasons why, the what, the where, and most importantly, the how to do it safely based on that expert's insights.
Yeah, we've pulled out those key questions, the resources like JCI and Patients Beyond Borders, and hopefully given you a framework for thinking critically about this whole complex issue.
Ultimately, this knowledge is about empowering you, the listener, to make the most informed decisions you can about your own health journey, whether that involves actually considering medical tourism or just understanding the landscape better.
Remember those core takeaways from the source. Focus on accredited facilities first. Ask those detailed questions, credentials, procedures, materials, and especially the costs of complications. And factor in enough recovery time, realistic recovery time, in a safe place before traveling home.
So here's something to maybe mull over, building on everything we've unpacked from the transcript today. When you think about the real challenges and high costs of healthcare access, especially in places like the U.S., and you weigh that against both the potential upsides and the very real risks of seeking care abroad, how do you balance those factors for your own situation, your own future planning?
Does that perceived risk of going overseas outweigh the potential benefits like cost or access for you? Or using the kinds of resources and steps we talked about, are there ways you could potentially navigate it to make it a safer, more viable option?
It's definitely a personal calculation, complex stuff, but hopefully this deep dive into the source you shared has given you a clearer lens to look through.
Thanks for bringing us this source. It was a fascinating topic to explore. Keep digging, keep asking questions.